Hello, this is Dr. Sandy, and I just want to say thank you so much for choosing our office for your wellness needs and getting healthier and stronger. So what I'm going to be doing, our staff has probably shown you this, but I wanted to make a custom video to show you how to properly do the stretches we've come up with at the clinic. And then you can refer back to this as much as you can, and it might be at midnight, it might be 7 a.m., you might be in a different country, but you'll have this video to help you. And of course, as you go through care, you can always talk to us if there's any questions you have. So how I came up with this, we always gave stretches to our patients, but let's be honest, everyone is so short on time. So I remember talking to one of my patients and I said I had to come up with a way that they could finish everything at work and literally go home and just rest then. So I came up with this system to still help the spinal cord, but make it super easy, which is what we're all looking for. So I'm gonna actually start at the top portion. So we always remember this controls literally our thinking, concentration, respiration, breathing. It's the most powerful part of the nerve system. So what we're gonna do is very, very gently, we're gonna turn to the left, hold for about a count of 30 seconds, okay? 30 seconds to a minute would be ideal, then 30 seconds to a minute onto the other side. Okay, we're gonna come back, and I'm just doing this for demonstration purposes, but again, 30 seconds to a minute. The most powerful stretch you should be doing is the one where you go back all the way, again, 30 seconds to a minute. And if you can, a more advanced procedures, the hands are in the back, and you're gonna pull back all the way like this. Again, 30 seconds to a minute. You can do this at work. The biggest reason I'm also making this video, and I wanna break that thinking some people have, is some people are just, just going back and forth. It's not doing anything. I remember reading the research and the person writing the book was saying you need 30 seconds minimum to open up a system, especially if it's feeling tight. So what you should be doing, guys, is we're gonna do the 30 seconds to a minute like this. Can I say another thing is as you're learning these stretches, if it's getting too easy, extend the time or extend the position. So what you can do is if you're like, okay, this is pretty good, a minute, go for 2-3 minutes if you can. Another thing you can do is that you can go here and say, well, that's pretty easy, but man, when I go a little bit further, I feel it. I want to make sure when you do these stretches, it's not just routine, you should feel a shift. You should feel a change, then you've done a stretch. If you did the stretch and you didn't feel anything, it's a waste of time. So always keep that in the back of your mind, and they should get easier as time goes by. Another question I get is that, 3 times a day, that's a minimum. You really can't do too much. Dr. Sandy, when I do this stretch, I feel sore after, then you may have to shorten the time. Now, some people are so acute, they have so many health issues, they can only do 5 seconds in the beginning, and that's okay, but we're gonna build up from there. So you always listen to the body. The key concept I want to share with you is if you've done the stretches properly and the appropriate time, you should feel refreshed. That's the feeling we're going for. So that would be part 1. All right, guys, so now number 2, we're gonna look at the lower body. So lower body, obviously a lot of people are sitting all day on a computer, maybe you're driving, you have a job where you're just sitting most of the time, or maybe you're going for that long trip back home, you're going for a trip to the States or whatever, you're gonna be sitting a lot. So what can you do in that situation? So we had a traditional stretch called the knee to chest. You need to lie on your back. Let's make things simple. So what you're gonna do is we're gonna take that knee and we're gonna come all the way up. Again, 30 to 60 seconds. Find a level you're comfortable with and you're gonna hold that. And that's opening up the lower body. And then the most important one of my favorites, there's one in yoga called the child pose or flexion. What you basically do, it's so simple, is wherever you are on that chair, obviously make sure the desk is far away from you, is you're just gonna go forward like this. And again, we're holding for about 30 to 60 seconds. Go as low as you can. Again, certain people might feel lightheaded or something, so use your discretion. Go as low as you can. 30 to 60 seconds minimum, it'll make a huge difference. Now, I would say the stretches I've shown you up until now is our basic protocol. Another one, if I can show you as well, that's a little more advanced, but if you can do it, it's obviously going to help as well for the lower pelvic and lower back, is just twisting the side to side. I really enjoy this one as well. We're going to hold again for 30 to 60 seconds. You can do this in the car, you can do this at your desk, and this will really help our results as well. Now, those are the basic stretches. Now, some concepts I want to share with you. Yes, you can do these throughout the day. Clinically, what I have seen is if you can do the stretches the start of your day, obviously several times in the middle of the day, and especially before you go to bed, we do get better clinical results. So please keep that in mind. Another people, sometimes we've told you to do icing or heating. What I would recommend is that you start with some stretching, open up the muscle tissue, and then depending if we recommended ice or heat, you can use that tool as well after you do the stretches. So you want to work with that. Hydration is king and queen. That's going to help the body and get better results. So this video, I want you to refer to it again and again. As you go through care, if questions come up, please let us know. We'll be there for you. And we look forward to help you on this journey of healing. God bless.